The U.S. coronavirus death toll has passed 80,000, by far the most reported deaths of any country in the world. The White House finally directed its staff to wear masks after Trump discovered the coronavirus in his inner circle. With so much at stake, the United States is struggling to decide whether to open up the country. Is it the time yet? And with another round of devastating unemployment statistics, how far is the U.S. from getting back to normal? I'm Zhong Shi in for Liu Xing today. Welcome to The Point. For our discussion today, I'm pleased to be joined by my two guests from Washington, D.C., James Early, CEO of Stansberry, China, and via Skype, Rick Dunham, co-director of Global Business Journalism Program from Tsinghua University. Also joining me on the phone, Professor Dai Xianfeng from Renmin University of China. Gentlemen, welcome to the program. James, let me start with you. You and Rick are there on the ground in America. I think it's fair to say that people are getting upset and angry and increasingly impatient with the daily rises in numbers. Their new infection cases have declined slightly, not substantially. And you get people asking the question, how much longer do we have to take all of this? How do you feel, James? Do you feel that things are under control and are headed in the right direction?
Well, when I drove in to do this interview today, I had basically no traffic, so that part is nice. And I think Americans are in general staying home, and the curve has flattened. So yes, we certainly have a long way to go. I mean, I might take issue with some of the descriptions in this intro. I don't think people are universally angry here. I think there is some frustration. In many respects, the greatest country in the world is so slow and disorganized to get testing under control. But we have flattened the curve. Things are getting better. So it's not a black or white situation. It is a matter of degree. But certainly, like many people, I wish we had been a little bit further along by now.
Rick, this is the greatest country in the world's largest economy. Yet things don't seem to have stopped completely. What do you think has been working and what is wrong here in the U.S. response to COVID-19?
Well, I think let's look at it at two levels. One is at the state level and the other the federal response. What is not working is the federal response. There are confusing and contradictory signals that are being sent. There's a lot of chaos emanating from the White House. In certain states, the responses have been excellent. And you start with New York State, which was the epicenter of the American outbreak, and then Washington State, which was where it started, where it was first imported from China, and the curve was squashed there. If you look at most of the country, things are going well, but if you look in some states, things are not going well. If you look, for example, my wife is in Texas right now, and in the city of Houston, the number of cases is going down and down. In the rest of the state, it's skyrocketing. And so there are problems because some people are prematurely trying to go back to normal life. Now, it's natural right now. It's natural because people are bored. I mean, everyone in China knows this from being 50 days or 2 months in isolation. Also, people want jobs. People want to go out. People want to spend money. But it's really too early. And I think that the places where people are patient and where public officials are patient will be much better off in the long run in terms of health care.
Professor Dai, as an outsider looking in, when you take a look at the situation in America in the U.S. response to COVID-19, what's your impression of what's being done?
Yeah, if I do a comparison between what has been done in Europe and the U.S. and what has been done in Asia, the biggest difference I saw was the initial, people just play down the whole coronavirus thing in Europe and in the U.S. Didn't treat it seriously until they saw the new case begin to increase exponentially, and then they panic. They began to implement the lockdown, all these measures. by then, it's kind of too late.
The big topic now, of course, is the reopening of the economy in America. And Rick said that people are getting bored. They want to go back to work. Absolutely. But can they do that safely? And in order for them to go back to work safely, for the economy to really reopen, we need two things: the testing capabilities and then the capabilities to trace and track people who've come into contact with COVID-19. Let's talk about the topic of testing. I want to put up this tweet from President Donald Trump, who says that our testing is the best in the world by far. Numbers are coming down in most parts of our country which want to open and get going again. It is happening safely. Is that the case, though, James? I want to go back to that unanswered question from a CBS reporter on Monday's press briefing, who asked the president, why does it matter when you brag about America's testing capabilities? Shouldn't we have a picture of things improving? Otherwise, why is it a competition to you? Why do you talk about how strong America is when it comes to testing, and we still have those huge numbers of people getting infected and people are dying every day? James.
Well, I share Rick's sentiments about the federal response to this, so you won't get much argument from me. It is a little bit embarrassing. Obviously, what matters is not aggregate testing. What matters is per capita testing, and the U.S. absolutely does not lead in per capita testing on any measure. But to be fair, in terms of opening up, I mean, it's not going to be a black or white binary thing. And one, I guess, relative advantage of the U.S. system, where you have states having relatively more power, is somebody in Montana might be a lot safer than somebody in Manhattan. And I think we're going to see that play out in terms of how the reopening is staggered. That's one dimension, at least. I guess the other dimension is certainly politics, and there is a lot of ideology, I think, among Americans, among American state governors. So we're seeing this mix of science, we're seeing this mix of ideology. If there's one thing this crisis has taught us, is that nobody really knows much about anything in terms of experts. Pardon me, there's an ambulance going past me, so it might be a little bit noisy as I say this, but the experts have been, even the experts have been wrong about so many things in this crisis. So we're about to embark on another experiment, an experiment that basically balances economic priorities with health priorities. And I think we all agree that human life takes precedence, but at some point we have to make that trade-off, and we're just about to see what happens.
An experiment comes both ways. What if it doesn't work out at an experiment? What's the price here?
Oh, I mean, look, there's no doubt. We could, as Anthony Fauci says, the U.S.'s top infectious disease expert, he thinks we risk reopening too soon and seeing a resurgence. Look what happened in Singapore. Look what happened a little bit in South Korea. Even China, which had a very strong response, very strong lockdown, has had cases come back, right? I mean, this thing is hard to control. So, yeah, certainly the downside is even more economic damage. We think we're doing better by reopening, but then we have even more economic damage by reopening too soon. Of course, the other end of the spectrum is maybe many more people are infected than we realize, and the virus isn't as deadly per capita as initial estimates, and we're being too conservative. There's certainly an argument to be made for there, too. So, I mean, nobody knows. I would side with Dr. Fauci, though, if you had to make me pick.
Rick, the risk is always there. The question is, are we doing enough to avoid what can be avoided? I want to get your take also on testing in America. Senator Mitt Romney thinks that you can't compare what's happening in America with what's happened in South Korea. South Korea, of course, is a top success story when it comes to sufficient testing. Right. Even when you say per capita numbers, where America is doing better with per capita numbers of tests, that's no comparison, because South Korea is a much smaller country. It's had a much more controlled outbreak of the coronavirus. Its daily increases, infections are in double digits, whereas the United States is reporting a daily increase of over 10,000. Your take on the testing in America?
Testing and tracking are absolutely essential that is what is inadequate across the United States right now. South Korea was successful because it was widespread testing at the beginning and then tracking people who had had contact with infected people. South Korea also was on the forefront of understanding the asymptomatic carriers, and that is what is so difficult. Right now, the way the disease has mutated, there are more asymptomatic carriers than symptomatic carriers. And unless you can track them, unless you can test people to find out who is carrying the virus, who is not showing symptoms, and who they have been in contact with, the disease will spread. And so that is what is essential. Right now, there are a lot of tests, but they are not spread out evenly in America. I mean, there are all sorts of political issues that we could get into, but the main problem is there are not enough tests where people need them. For example, in the White House, you can get tested. I mean, they are being tested every day. On Capitol Hill, when the Senate went back, there were not enough tests available from the Capitol physician to test every senator, let alone all of their staff and the support staff. And in a place where I live, in Virginia, just outside of Washington, I can only be tested if I am showing symptoms. So they will miss the vast majority of people who are asymptomatic, and the disease will spread. So this is a real problem, and this should have been a priority. China made mistakes at the beginning, but the United States had time to ramp up the testing, and for whatever reason, it didn't happen. Donald Trump is correct. There are a lot of tests available, but he is not right in that they're not getting to everyone, there are not enough of them, and there is no national strategy for testing and tracking. It's all being done state by state and locality.
I hear you. Professor Dai, Dr. Anthony Fauci, in his testifying speech, again warns against states opening too soon and the consequences that could follow. What we're looking at here is many states who don't meet CDC guidelines for reopening are prepared to reopen. What baffles me, and I think a lot of people, is that many people tend to think that the health and well-being of the economy and the well-being of the people are two different things. They're on two separate tracks, whereas in reality, you can't really have your economy back on the cost, on the compromise of human health and human lives. Think about this. What's going to happen when you reopen prematurely and you send people back into work, and those people that go back into the businesses to work and those people that patronize those businesses, if they come back down with COVID-19 again, you can't stay open for, what, 3 days, 5 days a week, 2 weeks, but then you're going to have to close down again. That's not having the economy back. That's something very temporary. What's your take on the prospect of many states reopening?
Yeah, there has been a historical study about pandemic. The conclusion would be you don't want to relax the control measure too early. If you do all the restriction measures early, and you follow it strictly, and the following recovery will be quicker and better. That's historical study. And then there are two different tracks. One is the scientific community. I think the vast majority would say it is too early right now to reopen. And then you got this political reality, and people, they try to, as the trade-off, right? Boris Johnson say, he didn't say it, he didn't admit it, but in reality, it is a trade-off. It's a trade-off between controlling the pandemic and growing the economy. And right now, let's see the damage is too much. So they, European countries and U.S., that's why they begin to either start it or they begin to think about it, the reopening.
All right.
Yeah, the biggest danger will be the second wave of epidemic.
All right, gentlemen, we have so much more to talk about. We'll take a short break now. And when we return, the state of the U.S. economy at the moment and the trade war. Is that about to return? Why is Trump making economic threats against China again? And why has he chosen the middle of a global pandemic to make that? Stay with us. Welcome back to The Point. Let's look at where the U.S. economy is at this moment. In April, unemployment rate stands at 14.7%. 20.5 million people lost their jobs. James, help us put those numbers into perspectives here. It's a lot worse than what we had in the last recession after the 08-09 financial crisis, where, if memory serves, unemployment rate peaked at about 10% in late 2009, and we're seeing all of those devastating statistics coming out of April. Just how bad are things?
Well, as you mentioned, it's definitely worse than the great financial crisis of 11, 12 years ago. Just April alone blew by the job losses we had there, and it took 10 years to recover those jobs. We've had roughly 33 million Americans officially lose their jobs because of this virus issue. The reality could be a lot higher. I'm forgetting his name, but the Dallas Fed president basically thought we could see unemployment climb to 25 or 30% at peak, although he is optimistic long term, thinking by the end of the year it could go back down to 10%. But even back down to 10% is all relative when you started it, somewhere between 3.5%, the lowest unemployment rate in 50 years. So it's gone from really good to really bad really quickly.
Professor Dai, your read on the economic status there in America. Will it get back the jobs? Will the economy get back to normal as soon as the Trump administration says it will?
Yeah, the hit to the economy is unprecedented. That's just a fact, right? Any number you look at. Yeah, look at the GDP number, the jobs, the jobless claim numbers. That's a weekly number. As a non-farm payroll, to the monthly number. So all the numbers you look at are just really, really bad. It's on totally different scale historically. You go back to history, you cannot find anything like what's happening right now. So that's a fact. And if you look at detail, though, a lot of stuff could be temporary. You look at the jobs numbers, and the vast majority of the people who lose their jobs, they're just temporary. They just lose the temporary unemployment. So assuming the economy come back on track, it could be for those guys to be hard back pretty quickly. However, if there is a prolonged economic recession, the temporary stuff could be permanent, and that could be create a permanent damage. So my take on the economy is it is hit really, really hard for now. You could say temporarily, and there's a danger going down. It could be permanent.
Professor Dai, let me follow up on that. When you say that it's going to be a prolonged process for recovery, do you have a timeline for when things will get better? Because President Trump seems to think that the economy will be back very soon. He said that we're going to have a phenomenal year in 2021, but some analysts have pointed out that some of those jobs lost in this pandemic will not be easily and quickly recovered, and the road to recovery will be a tough one.
Yeah, right now, I think the consensus, when the market is looking at it, the consensus would be the worst month was April. And, starting May, the U.S. is gradually trying to reopen the economy. So, possibly it could get a little bit better, just on the margin. And then it really depends on what's going to happen next. After the reopening, if everything goes smoothly, if you don't have the second wave of the virus, conceivably you could have a V-shaped recovery.
I see.
Yeah, but again, there's a lot of risks.
Rick, as we've been talking about, the reopening could cut both ways. So when we say that many local economies are going to reopen starting this month, going into June and the latter half of this year, will things look better?
Well, we hope so. If we can be safe, if we can stop the spread through the testing and tracing, then people will be more confident. But I do believe that there is lasting damage. I believe that some people will go back to work, but you're going to have less consumer demand, which means that there are going to be some jobs that are not necessary. So, for example, the restaurant industry, the service industry, the tourism industry, the arts and entertainment, all will have long-term damage. And then I think some businesses are going to have lasting damage in that there's been a lot of telecommuting, a lot of virtual working, and they will discover that there are redundancies, that there are people and jobs that are not needed to have a company work well. So I think that you will have, at best, a new normal, even if the healthcare problems are taken care of. I think that a V-shaped recovery is highly unlikely, and I think the best case scenario is similar to the end of the 2008-2009 financial collapse, where there were a lot of ups and downs for about 2 years before the steady recovery through the rest of the decade. And I really do think that the big risk right now is opening too early. Where my wife is in rural Texas, for example, restaurants reopened, and in one of the restaurants, one hamburger restaurant, it's already shut down because there was a case of a sick employee. So it opened for 2 days, now it's closed again. So I think it's really risky to reopen too early.
That's a very micro and very vivid example of what things could happen. Gentlemen, let's spend some time talking about China and the China-U.S. relations caught up in this pandemic. James, what's going to happen to the Phase 1 trade deal? Both sides, of course, have expressed commitments to upholding the deal, but could this pandemic get in the way of both sides fulfilling the terms stipulated in that deal?
Absolutely. I mean, Trump has been suddenly talking very, very tough on this, basically saying if China doesn't meet its commitments, then he's prepared to back out of the deal. And obviously, I think most reasonable people would look at this virus situation and say, well, you know, it wouldn't be the end of the world for people two countries to just renegotiate a little bit and talk, because it may in turn be hard for the U.S. to supply some of its stuff. But, I mean, to be fair, there was questioning about, could China buy all this stuff from the U.S. even before this virus hit? I think if China pulls it off, if China makes its commitments, that will be a major win for China. It would be very hard for Trump to back out of anything at that point. If China is not able to make those purchase commitments, I suspect he's going to use that as a reason to back out of this deal. And I think, just speaking not as American or as Chinese, just as a human, I think it would be sad, because these countries have worked very long and very hard to make that deal, and that was kind of like a nice green shoot in terms of a relationship improvement, but I think that's going to hit rocky times.
Professor Dai, we've already seen tensions rise between the two sides in the middle of this pandemic. Hopes are that they will not hit a stumbling block in their efforts to fulfill commitments included in the trade deal. What's your take on how the two sides will do their best to uphold the deal and fulfill the commitments?
Yeah, what I observe is from the U.S. side, there is kind of a back and forth.
Okay.
I mean, yeah, Trump is kind of threatening new tariffs, you know, because of the coronavirus thing. And then you get two top officials, including Steve Mnuchin, came up saying, you know, still working on the deal. And then you get top-level officials from both U.S. and China talking. So a lot of things going on. And but if you look at the future, there is a lot of uncertainty. because of the U.S. presidential election in 6 months. So from political, there's a political side to this story, and the president is trying to defeat Joe Biden. And when he's saying, and Joe Biden is soft on China, so he's going to play the China card one way or another down the road. And the trade deal is one of them. So anything can happen.
Rick, we don't have a lot of time left, but I want to get your take as well. So much uncertainty going ahead this year. What's going to happen with the Chinese economy? What's going to happen with the U.S. economy? What's going to happen with the election? How will those factors play into the two sides upholding the trade deal?
I think with Donald Trump, the election is issue number one, issue number two, issue number three. Donald Trump wants to win re-election. Polls show him trailing both nationally and in key swing states. So I think he believes that attacking China, criticizing China, is his best issue right now. So I think that he will use it in every way he can, and whether that is blaming for the coronavirus to begin with, or on trade. I think that some of his economic advisors want to be cautious because they don't want to do something that would make the global economy worse. Tariffs generally, historically, have not been good for the global economy. And as far as China is concerned, it's in China's economic interest not to have any kind of setback in terms of the relationship with the U.S. Buying and selling products back and forth is good for both economies. And so I think China wants stability. I think Donald Trump just wants victory right now.
It's going to be a complicated year, and that's an understatement in the relationship between China and the U.S. Gentlemen, thank you so much for your participation. Many thanks to James Early, CEO of Stansberry China, and Rick Dunham, co-director of Global Business Journalism Program from Tsinghua University, Professor Xianfeng from the Renmin University of China. Appreciate it. As always, follow us on Facebook and Twitter using the handle ThePointWithLX. Download the CGTN app to watch our show, or go to YouTube and look for CGTN The Point. I'm Zhong Shi in Beijing. Thank you so much for watching.